gonna be in addition to your checkoff, and you're gonna help your new students along the way. You're gonna chart your patient's mouth. So I'm gonna give that to Sarah. I'm just gonna dictate what John has. Okay, first thing I want to get to know is our patient comes for a cleaning every 6 months, or this may be his first cleaning in a while. So we got to investigate and see where he's at. So first questions I'm going to ask him, how much do you brush? Or when was the last time you had a cleaning?
6 months ago.
About 6 months ago. How often do you brush?
3 times a week. 3 times a day.
3 times a day? When's your third time?
Night. Morning, lunch, night.
Morning, lunch, night? Very good. So you should have no plaque, on your teeth is what we assume. How much do you floss?
Twice a day.
Twice a day? You like to floss? Do you use wax? Do you use Glide?
Wax.
Wax? All right. Do you have any other issues with your teeth?
No.
Okay. Any odor concerns or anything like that? None? All right. So I'm going to get ready for my patient. Patient has a bib. Washed my hands already. You put your mask on first. Glasses next. This is the order. And then your gloves. All right. Let's start with the procedure checkup. What instruments do I need? What does this say on the top?
You need basic setup.
Basic setup. Mouth mirror, explorer, cotton forceps, articulating paper, air water syringes, and a basic. Okay.
Here you don't have probe.
We don't have a probe in our lab, but you would need one in your clinic when you go to your office. They will have that. It's set up as well. Or the explorers also have a probe end, so you'll have an explorer or a probe end, depending on what you do in your office. The probe actually measures the depth of the tooth or the bone to see how healthy that one single tooth is. So we don't have that.
We need a disclosing liquid or tablet.
Okay, we have tablets here. This is what our tablets look like. It should be in the Profi tub. If you don't find them in there, they're purple or pink. They stain plaque. Okay, next.
We need a disposable Profi angle.
All right, so we have 2 different types.
Just a little
We
quick
have a Profi cup and a Profi brush.
I'm going to interject just for a second. The tablets come in pink or purple. The purple will stain present, new plaque, and existing plaque. The red ones stain it all the same color. Some doctors like to use the tablets with purple to see, so you can show your patient, see this band? It's a lighter color. Do you see this darker band? That's been there a long time. It's to show, it's to measure success or lack of success of what your patient's doing at home. It's called trace. That's the difference. Sorry, baby. I just wanted to add that a little bit.
So Profi cup or Profi brush. The brush is for ortho patients, and the cup is for smooth surfaces. So if they don't have braces on, this is the one you're set up. Occasionally in your office you may get both because you do the braces and then you have the lingual side, so they're smooth. Okay. What else?
You also need a Profi paste.
Profi paste. So that's any of these little guys here. These have different grits on them. They can be coarse, they can be fine. The grits have little sand-like inside the paste to help remove stain. Okay. Next.
Dental floss.
All right. Dental floss. This time, please take out 18 inches, right? Because we are flossing the entire mouth. So when you gave me floss before, I've only wanted a few inches. This time I want an arm's length out because I'm going to floss the whole mouth, okay? Next.
Toothbrush and handheld mirror.
Okay, I don't have that. And then I have gauze just in case I need it.
And a tooth chart.
And a tooth chart. Okay, I gave that to Sarah. Let me go get a toothbrush.
Now, I want you to notice something, very important. She left the operatory, but what does she not have on her hands? Which is a good thing, perfect. You never leave an operatory to get up and do what she just did with your gloves on. That's why you want to make sure that your room is completely set up so you don't have to get up. Okay? She was going through everything, making sure she's got everything for you. That's why her gloves aren't on. Now, the last thing she's gonna do before she goes into the mouth is obviously put your gloves on, right? Just gonna make sure your room is set up 100%. When you're in clinic, you want your hair pulled back so it doesn't fall forward. Hair back in a ponytail, if anything falls forward, you need a bobby pin.
Alright, this is a lot about customer service as well. If you have a mirror like this, don't give it to your patient, okay? Just anything you give to your patient that's spotty or looks ugly, they're gonna assume that everything that we use looks that way, so just give it a little clean before you hand to your patient. Okay, I'm gonna hand him that. I'm gonna put my clothes back on. Give this to you. So what I want you to do is I want you to show me how you brush your teeth.
Like, actually put it on my mouth.
Go ahead and brush. I'll hold it for you. You need? Okay. All that. All right, so we're going to demonstrate a brushing technique. There are different types of brushing techniques. There's actually 6 different types and different ways that we brush. In his technique, we're just going to tweak it just a little. He didn't do anything wrong. Maybe his circle, if you notice, his circle was really big. Let's just guide him. So go ahead and look in your mirror. I'm just going to show you how I want you to really brush, because you were doing something like this. Go ahead and open slightly, and we're just going to focus on a couple teeth at the same time, doing smaller circles, okay? Put your head back. Relax. Hold on, put your head forward. Okay, now go back. Okay, so we're just going to open just slightly and then do smaller circles, okay? If you do big circles, when you bite down, go ahead and bite down. You're missing the top portions of those teeth on the bottom. So go ahead and open again, and we're going to just separate the top and the bottom instead of doing it both, okay? Then you're going to turn your toothbrush at a 45-degree angle. What that technically means is brush towards gums. And then we're going to clean upwards. If we're working on the top, that cleans the gum tissue up there. Turn it downwards, and we're going to clean the gum tissue on the bottom. If you notice, our toothbrush also has different lengths of bristles. Okay, our different lengths of bristles also help us in guiding which area we're going to clean. The taller bristles, I'm going to show you how to use those. Okay, the taller bristles I'm going to use for the anterior teeth. So I can't talk to my patient like that. Canine to canine, we're going to use tall bristles. You're going to put your toothbrush straight vertically like this, and then you're going to clean during circle and pulling up motion at the same time, so you're getting the gums and you're getting the tooth. And you're just going to rotate back and forth, canine to canine, for a while. Let's do 30 seconds here. And then you're going to flip, same tall bristles, and you're going to do canine to canine on the top, circle motions, and pulling down now. Also getting that gum tissue. You feel me on that gum tissue back there? All right, you got to make sure you clean that gum tissue. All right? So that's how we're going to demo toothbrushing instructions to your patient. You actually have to provide the instruction and show him. So you're doing a tell, show, and do at the same time so he sees it. Then you're going to have your patient demo what he just learned. I can hold the mirror if you want.
I got it.
Are you sure?
So,
Okay. Open. And you got to make sure you tell yourself to open, or you have to tell yourself to do small circles, because if you don't, you're going to resort to brushing the way you've done in the past.
okay.
Okay, so every morning, and it's a habit. Toothbrushing is all about habit. No matter how much I just instructed you to change, you have to make sure you change it, because if you don't tell yourself to change it, you're just going to be brushing the same way, still missing some spots.
Okay. So, open, small circles, focusing each teeth, right?
Yeah.
And then lotto, canine to gum line, canine to canine, circular motion, right?
Right. And how's your tongue cleaning? Do you clean your tongue at all? Did you use your
Scraper.
scraper that you just got?
Yeah.
You like that? Do you see how much grap comes out of it?
Yeah.
It looks gross, doesn't it?
Yeah.
Okay, so tongue scraper as well. So if they have bad odor, they want to talk to you about odor. That's another thing we have to hit on, is talking about cleaning the tongue. The distal portion of the tongue, so the back portion of the tongue, has bigger papillae on there, and more bacteria can stay attached to that tongue. So if you don't clean your tongue as your technique is cleaning at home, you can end up with odor. So tongue is also an important part of cleaning as well. Okay, don't forget to clean your tongue. Separate toothbrush is better, but if you're going to use the same toothbrush, use it after you clean your teeth, and then after. Otherwise, you're just moving from bacteria to teeth, and then so you want to do it after. All right, next I'm going to have my patient chew on some disclosing tablet. All right, with this tablet, you don't swallow, okay? You're going to chew it, and you're going to just swish it around your mouth, and then you're going to spit it out for me.
With no water.
No
That's
water,
awesome.
here you go. Go ahead and chew it. He's going to have purple lips all day. Vaseline helps with that, staining for men or protecting coat. So Vaseline also is a protectant. So you want to put some on the lips.
That is real purple.
It's purple. Okay, I'm not trying to embarrass you, but smile for everybody. All right, so this is what the disclosing solution
Oh my
has on
Lord.
there. Yeah. You see the darker purple. The darker purple, what Miss Meekins was talking about, is where he missed for a while. So he may have missed that this morning. The lighter purple or pinkish is now the new plaque. So we have dark old plaque and new plaque. So that's what she was explaining to you on the different color or the scale of colors that's in the mouth.
Ms. Martinez,
Yes.
do you because on here you have us do the disclosing tablet and then practice with the toothbrush? Do you want us to do the practicing with the toothbrush before the tablet?
I do that before, and then I show my patient when he missed. Because if he brushes, I'm going to prophy it off. So that's also my guide to make sure that I'm removing everything for me. Does that make sense? So that's why I do it kind of a little bit different. I'm going to talk to my patient first, and then I'm going to show him so that he knows I'm removing everything for him. It's kind of how I do it. All right, so go ahead and smile. All right, so now I'm going to dictate some charting stuff to my assistant. So you're going to have an assistant. Turn your check off. I'm going to lean you back. This head thing is off. Come up.
Just FYI, new people, I know the existing, know those headrests adjust. When you put your patient in the chair, the first thing you do is adjust it, so it cradles right back here. It needs to support the occipital to take the tension off the shoulders. Don't just put them in there and have them try to find a position that's comfortable. Your job is to make them comfortable. It's an easy process. She'll show you how to adjust it. Most people don't know the moves.
Yeah, so you notice when he was going back, I saw his neck was going to be out of position, so I was just kind of making him comfortable in my chair. If their patient is uncomfortable in your chair, trust me, you're going to have to stop and stop and stop to readjust your patient, or your patient's going to make you stop to readjust themselves. So just do it before you get started. All right, I need my light. So what I'm going to go in and do is I'm going to just dictate to my assistant. 1 is present, 2 is present, 3, 4, 5, 6, 7, 8 are present. It looks like 16 is missing, 17 is missing, and 32 is missing. Actually, 1 is not present. 1 is missing itself. All four, yeah. So 1 is missing. 1, 16, 17, and 32 are missing. I'll give you a rinse. It's just a lot of disclosing solution inside his mouth. I'm just gonna give him a little rinse. Open. Okay. Now on the check, on the big teeth. Do you have the big teeth chart? Did I give you that or no? No? This guy. On everything that I tell you, I want you to mark red.
Just
Red's
like
gonna-
line.
Yeah. Okay, I got the buckle of number 2. And I have interproximal mesial distal between 2 and 3. Mesial distal 3 and 4. 4 and 5. 5 and 6. 6, I have gingival third. Mesial distal 6 and 7. Mesial distal 8 and 9. Mesial distal 9 and 10, 10 and 11, 12, 13, 13, 14. Buckle on 15. Occlusal on 12, 13, 11, 10, 9, 7, 6, 4, 5. So I just did all the maxilla. Jump down to the lower. I got interproximal between 1920, 21, 22, 22, 23, 24, 25, 26, 27, 28, and 29 proximal. I got facial or buckle on 19, 20, 21. I got a buckle on 31, 29, 28. Lingual gingival thirds on 19, 20, 21, 22, 28, 29, 30, and 31. All right, will you hold that up for me? So John, you want to turn your head towards Sarah? So all those places that we just dictated have plaque on them, visible plaque. So those are areas that you've been missing, okay? So I'm going to now clean them off. You need a straight handpiece motor and a straight cone. That attaches your prophy cup. Slow speed. And then I'm going to pick my prophy paste. First thing I like to do with my prophy paste is I'm going to push my rheostat and I'm going to put my cup in my prophy paste. I'm going to make it soft because look, it's hard. There's nothing in my cup. So I'm going to just stir it around a little bit just to make it a little softer so I can work faster. So now I can just scoop in and it'll be ready to go. All right, so I just made it soft. Got some in my prophy cup.
Is that one real gritty?
I don't know. It smells really good though. Okay. Then we're going to start on the upper right quad, tooth number 1. Or if he doesn't have number 1, we're 2. And then, okay, so I'm running out of room because he's open a little wide. I'm gonna have my patient close down slightly. All right, and then I'm gonna start my Prophy cup. I'm pressing a little. If we're talking about speed, we're gonna use your driving foot and you're gonna go only 20 miles per hour. Okay, so I'm taking my Prophy brush. If this is my tooth, I'm going from the distal and curving to the mesial. 3 seconds on the tooth, I have to lift off because this creates friction, will burn the tooth. Okay, so you can't stay on longer than 3 seconds on a tooth. Now it's not turning.
Turn the base of the cup.
There we go. You also want to make sure you get into the gum tissue. So you're going to take your Prophy cup, you're going to press a little bit, we're going to flare the cup, and you're going to go into the gum tissue as well. Okay? So if you guys can't see me, you guys can come up anytime.
Anybody sitting down, you can't really see what she's doing, because when you're doing demo, you wanna be up looking in the mouth, because that's where all the action is. And the new people, I know you've not seen anything, this is gonna go, we're gonna go over this with you so many times that you're gonna see it in your sleep, so don't worry. I know it sounds like grief to you right now, but it won't. The only way you
See
can
how I
on
get all
demo
up
is
in
to
that
stand
gum
up.
tissue?
Don't sit.
That's what we want to get. So you see how now there's a little bit of bleeding? I'm just going to tell my patient, okay, flossing. We're going to go over flossing instructions when I get to flossing because he shouldn't bleed if he has healthy mouth or gum tissue. And if he does, that means we have to talk about flossing now. He said he flosses 3 times a day, right?
Not to that.
But if he flosses that many times, he should not bleed, okay? So I'm going to continue.
It tells you he's committed to working hard if he's doing it 3 times, right? But he needs our help to perfect it. He's spending way too much time not with no results.
And you see how I also, look at my hand positioning when I'm holding my slow speed motor as well. I'm holding his chin because that's my fulcrum. Like I'm holding a pencil as well. So I'm writing and then I'm grabbing, okay? I'm gonna retract, turn towards me a little bit. Upper right or upper left quad. So again, 20 miles an hour. Only 20 miles an hour. I did the upper right facial and I'm doing the upper left facial. Give yourself a little break. Your patient needs a break and he's gonna want to rinse. So let's rinse what we just did. Open.
So would you wanna rinse after every quad?
You can. Your patient's gonna guide you onto how many times you should rinse. So each quad, you can give them a break or continue if you don't think there's a lot of stuff. Some patients will be like, I don't want to swallow anything, and he wants suction all the time. So you got to be in control of when you give your patient breaks or rinses. So I just did all the facials. Now I'm going to do the lingual. Your mirror is going to help you do the lingual. Notice how my back is also straight. My feet are wide apart, and I'm not tipping forward looking in my patient's mouth. I'm going to use my mirror for indirect vision for the lingual. Again, turn towards me. I can see the lingual on the upper left quad. I can't see the lingual on the upper right, so I'm going to look like this, okay? I want to stay straight with my patient and make sure your back is always straight as well. Open wider. Do my linguals now. Open a little wider so I don't hit your teeth. And you see, I can only see 3 seconds on these teeth, so I'm going back over if I missed the spot. You could go back over anything you've missed, meaning if there's still purple staining on the tooth. I'm also gonna share my Profi paste with a couple of teeth. Turn towards me a little bit. Thank you. I changed from indirect vision to directly looking because I can't see these teeth in the mirror very well. He's filling up with saliva, so that's my cue. Give him a break.
John, you're cracking me up.
I'll give you a
I
break.
love his honesty. I do.
Open.
Ms. Martinez,
Okay.
can I ask you a quick question?
Yeah.
Do only edits do this, or can dental assistants do it too?
We are the ones that do it.
Dental, okay. So
All
how often, do you think this is something we'll do immediately?
All the time, every 6 months. There at least will be at
No,
least
when
8
we-
patients
Even in
today.
our extern and
Oh yeah.
stuff. Oh, okay.
They expect you to be able to do this
Yeah.
Thursday.
Okay.
This and X-rays for
And
sure.
extras, okay.
Okay, so I'm jumping now down to the lower left quad. I need some paint.
Hi, everybody.
Hi, John. Looking good.
You're the show today. All right, and then open.
You okay?
Now, when John goes home, he can take that colored chart that she created for him, put that by the mirror where he can see what he's doing, and concentrate and bring focus to the areas he missed. That's why that's part of that checkoff. That's like an athlete goes in to watch the video of the game to see how they did what they did. If you can't see what you did, you can't change what you did. That's a teaching tool that's very important to do. You can't see it, you can't learn it.
No, I had morning sickness with mine.
Really?
My girlfriend was so
This procedure, yeah, you're gonna do often and a lot. Sorry, my nail just poked you. That's why we keep our nails short. It's because I can poke my patient doing my fulcrum. All right, so I just did all my buccal and facial. Now I do my lingual. Then now you got to retract that tongue. And we're going to go on the inside.